Good evening, everyone. Good evening, Allen family. Good evening, Ignite. And then on behalf of our youth pastor, Reverend Edward Jordan, I want to invite you to this amazing conversation, much needed, timely conversation. Are we safe? A forum to help families navigate COVID-19. Family, this conversation is designed to give us some information and help settle our nerves and anxiety around our reentry and return to school as it relates to our children, as the first day for some is underway. And for some who have already started, we have some amazing panelists with us tonight. And we're excited that they're here with us. On behalf of Reverend Jordan, in his absence, he sends his love, his thanks, his gratitude, and his appreciation for this platform. On the behalf of our pastors, the Reverend Doctors, Reverend Elaine and Floyd Flake, we want to say thank you for joining us tonight, family. Listen, I'm going to give you a few minutes to share. I'm going to give you a few minutes to come on in, because this is a conversation that we all need to be a part of, that we all need to have, because what's happening in our world today is affecting us all. So I'm going to give you a few seconds to text somebody, to press share, to invite somebody to meet us here, right here at our Greater Allen social platforms for this dialogue around are we safe? It's the question that we've all been asking for the last year and a half, and we're excited that we've had some amazing, I'm going to say, experts here to help us navigate the conversation and answer this question for us: are we safe? So, family, tonight, you should have shared by now. That was enough time for you to share. Wait, I didn't introduce myself. I am Minister Sharice Wickford. I serve as the co-minister of the young adults here at the Greater Allen Cathedral. I am standing in for my friend and brother tonight. And I'm excited to help facilitate this much needed conversation that we're getting ready to dive into. Family, we're not going to belabor the hour, but we're going to bring on our guests. And first, I'm going to start with, we have some amazing women who here tonight, who's going to help us unpack this, how to navigate, right, schools right here during this time as we are still navigating COVID-19. First, to the stage, I'm going to bring Dr. Natalie Matherin. She's going to come on, and I'm going to allow all of our guests to introduce themselves. But first, let's welcome family of Dr. Natalie Matherin to the stage. Welcome, Dr. Natalie. Thank you for joining us here, family. She's going to introduce herself in a few minutes. Next, we have no stranger, the Reverend Dr. Deborah Wortham here with us tonight. This is family. Make some noise in the chat. We don't got no flakes with us tonight. We got some solid people of God with us who's going to help us navigate this conversation. Then we have Principal Anisha Jacko with us tonight. Listen, we got some of everybody here. We got the principals, the pediatricians, the superintendents, and last but not least, the licensed psychologists, because we all need one, right? Our children need them, especially during this time. Let's welcome Dr. Rochelle Robinson to the stage. Welcome, Dr. Rob.
Hi.
Good to see you. So, family, I'm going to allow them to introduce themselves, and then we're going to pivot into our conversation tonight. Principal Jacko, won't you introduce yourself to us tonight? Following Dr. Wortham, then we'll go over to Dr. Matherin and conclude with Dr. Robinson.
All right. Good evening, family. My name's Anisha Jacko. I am a proud principal in District 29. I lead an elementary school, a pre-K to 5. I'm also a mom of a 10 and 8-year-old. So I serve as both a school leader and a school mom myself. I'm married to the wonderful Mr. Wayne Duhaney, and so I'm just so excited to be here, as well as a minister from Greater Allen. So thank you for this opportunity.
Great to have you, Dr. Wortham.
Good evening, family. I am Deborah Wortham, Superintendent, Roosevelt Union Free School District on Long Island. I am excited to serve the community there. We have over 3,000 students that we serve each and every day.
Mhm.
This is my 14th year serving as superintendent in 5 districts. Wow. I am married to the one and only Chester Wortham, Reverend Chester Wortham, and we have 2 wonderful children. I say children, even though they have children, but we love the Lord and we love the calling that He has upon our lives.
Amen.
Good evening, everyone. I just have to say, I love the energy that I'm in these rooms with tonight. I'm in Philadelphia. I'm a board certified pediatrician. I work for Greater Philadelphia Health Action, which is a consortium of federally qualified health centers here in Philadelphia. And I'm also the former medical director for the school district of Philadelphia. So why am I here if you guys are there? Because my heart is in New York. I'm a Brooklyn girl at heart. So when I was asked to do this, I jumped at it. So I'm very excited to be here. I should say I'm also the mother of an 8-year-old who started school today, Mr. Marley, and my husband, John Mark Matherin, very supportive. Happy to be here.
Amen. Appreciate you. Welcome.
Thank you.
Good evening. I am Dr. Rochelle Robinson. I am a licensed psychologist and a certified school psychologist. I have worked in schools for the last 13 years with every grade, all the way from K up to college. So I am the owner of Pivotal Point Psychological Consulting and a professor at St. John's University. It's great to be here tonight.
Thank you, ladies, for those amazing introductions. So, family, as you see, this is a quality, a solid group of powerful women, Black sisters, who's going to help us navigate this conversation. For those of us who don't know, this conversation is designed to provide knowledge, strategies, and other relevant information for parents and guardians on how to keep their children and families safe during this upcoming school year amidst the continuing COVID-19 pandemic, right? We hope to provide insight into the academic professionals, projections, safety strategies, and protocols for the year. We know that is one of the greatest concerns regarding reentry to schools, the safety protocols. Like, what do y'all have in how many janitors is on the staff? Are you going to clean the bathroom every time my child come out? Like, are you going to wipe down, people going to be busting tables every time? So that is one of the major concerns. In addition, we hope to provide factual information regarding the scientific nature of COVID-19. That's why Dr. Matherin is with us tonight. And the various variants, right? Particularly amongst school-age children, right? I was joking with some colleagues today, and I was just like, I really don't know where we're going to be in November, because all it's going to take is for that preschooler to swap out his Paw Patrol mask for the document stuffings, right? So we don't know where we're going to be. So we're excited that we have a diverse panel that's going to help us answer a lot of the questions that we've been wrestling with in the various categories. We will also provide preventive strategies to protect families during the year. So let's get right into it. Dr. Matherin, this question is for you, right? Because we want to get a lot of parents want to know about the medical issues and the medical strategies, right? How does COVID-19 function, and what is the spread trend amongst children?
Okay. Well, COVID-19, it has so many names, right? We've heard so many names since this thing started. So COVID-19, coronavirus, SARS-CoV-2, how do we put all of that together? So COVID-19 is a coronavirus, and there are many, like hundreds of thousands of coronaviruses that we've been exposed to before that cause very minor illnesses, but not this one. COVID-19 is particularly virulent, which means that it has caused or can cause severe damage to various parts of the body. That SARS-CoV-2 name that it has, that stands for severe acute respiratory syndrome. It gives you like a little inkling into what it can do, but that's only the start. So COVID-19 is a coronavirus that is novel. That's another name that you've heard associated with that. It's a novel virus, meaning that our bodies have not seen it before. It is new to us, and that makes it particularly troublesome because our bodies don't know exactly what to do with it. It is a virus that is spread by respiratory droplets. So imagine any infection that you could think of. One that is going to be particularly terrifying is one that spreads in that fashion, because that's very easy to spread. Respiratory droplets, not talking about forceful droplets, even from a sneeze, even just talking, that amount of exhalation can spread that virus. So that is what COVID-19 is. And what was the second part of your question?
What is the spread point amongst children?
Yeah, it's particularly troublesome now. Early in the infection, early in the pandemic, we sort of thought that this didn't affect children very much. And what we found over time is that it does affect children, but children have varying presentations. So some children may be absolutely asymptomatic. Some children will have a range of infection where you're seeing, what is typically thought of to occur with coronavirus and COVID-19 respiratory symptoms. And then some children, we'll get into that, have a very inflammatory effect on their body that can cause things all the way to cardiac arrest and failure. So what we're seeing now, as more of the adult population is vaccinated, not all of us, not as many as we want, but as more of the adult population is vaccinated, we're seeing the proportion start to shift to children. So during the last week in August, I think the American Academy of Pediatrics put out a report that said a quarter of the new infections, a quarter of the new weekly infections are occurring in children. Now that is, phenomenally different from where we were when it started. I think they recorded that week 250,000 children infected. So, again, children don't have very prominent symptoms, but they can. And even the children that don't have prominent symptoms, they are very able to transmit the virus to older persons. So it is very problematic that we're now seeing increased trend among children.
Nice. Thank you for that. Follow-up question, then I'll pivot to our principal, right? Is there any data? I know you mentioned some data with the numbers with adults and the amount of children, being exposed to COVID. Is there any data about the effectiveness or ineffectiveness about the vaccine amongst children in the population?
Yeah, there is. Right now, the vaccine that's available for children is really the Pfizer vaccine, right?
Okay.
So for children 12 years and older. So in the 12 to 15-year-old age group, they found that there's 100% effectiveness of that vaccine. Children that are 16 years and older, there's a little bit lesser of effectiveness, but still 91% effectiveness at prevention of severe illness. And this is preliminary, and they're still sort of matching out this data. But currently, early research shows that there's 96% effectiveness of that vaccine against the Delta variant, which is really great. We hope that continues to par out, but it's early.
Awesome. Dr. Jacko, talk to us. Dr. Jacko, I don't even know if you doctor yet, but I just threw it out there because everybody else on here. Principal Jacko, talk to us about the safety protocols that school have been implementing, or your school have been implemented and instructing to help protect children.
Thank you for the question. And so, Doctor, you're giving me some homework. And so I just want to say I'm speaking on behalf of myself. As with anything, any board of ed, any county, depending on where you are, there are clear guidance given to every school led by our superintendent and our different leadership. And so, with that said, specifically for me and my school, what I can say is those safety protocols is that all staff has to be vaccinated. And if they're not vaccinated by a certain time, they will have to be tested weekly. And so the certain protocols is at the school safety desk, there are health screenings that are being taken account for. You can also download that on an app. In addition to that, you cannot enter a school without showing your card. And so school leaders have a portal knowing who on your staff has that. In addition to that, just following certain guidelines. So for specifically, if you're in New York City, there is a whole website on the schools.nyc.gov. There's a special homecoming pamphlet for parents, and I would say definitely get involved with your school and touch base with your parent coordinator. We definitely need voice from our families. And so if you have any questions, feel free to connect with the school. Everyone has designed and worked hard to make sure that everything is curated to match the needs of the community and the families.
Awesome. A follow up to that
Yeah.
for you, Dr. Jesus, Principal Jacka,
Yeah.
right? What are the adjustments you are making to accommodate non vaccinated children, if any?
So, because we are an elementary school, our students are not vaccinated. So there will be weekly screening for children to be tested.
Okay.
So our students, you understand in New York State, it's 12 and up. So our students are not more than 10 years old, 10, 11. So that is not really something that for our school, that might be something for upper grades, specifically if they are participating in sports. Students in those grades, I would say middle school and up, will have to follow some of those mandates given to them by the state.
Awesome.
Okay.
Awesome. Dr. Wortham, tell us how schools or maybe your district plan to handle potential outbreaks.
Thank you so very much for that question. And Principal Jacko, as well as Dr. Matherin, I could have you on my team forever. Absolutely accurate. Now, Principal Jacko gave a disclaimer. I'm not going to put a disclaimer because I know that I work hand in hand with our Board of Education at the Roosevelt Union Free School District, and we follow the CDC guidelines. We follow the guidelines from the Department of Health. We follow the guidelines from the New York State Education Department. And everything that we do, we have facts to back it up. So, in reference to what do we do with a breakout, let me just go back to 2020 and say in 2020 at that time, if there was a student or a staff member in the district that tested positive, we absolutely would shutter, we would close that school for that particular day. We would go into deep cleaning, and of course we would go into the contact tracing. We would contact the Nassau BOCES to report that someone tested positive. And that could take a long time to follow up with the contact tracing and then to quarantine the appropriate individuals. Fast forward to today. Well, let me just go back again. This is historical in nature because I'm going to go back to the first day that the Dr. Matherin said when she said the coronavirus. I remember March 6, 2020, when I received the phone call from the Commissioner of Health, and she said, "You have 3 students who tested positive for corona." Now, forgive me, Reverend Elaine, because the only thing I knew about corona was, and I said, "What is that? Is there a pill? Okay, I have to go back to this meeting." And she said, "No, this is a virus." I said, "Well, if it's that serious to close 3 schools, we have to close all 14 schools." And we started from there. And then, so that's how we handled that in 2020. Now, with the state health commissioner, Howard Zucker, said, and I'll say this verbatim because we promote the facts. All school personnel, including bus drivers and contracted bus drivers, must either submit proof of full vaccination against COVID-19 or submit to weekly testing for the virus.
Mm.
Given that, we have another word that we operationalize now, and that is cohort. So now we have our students who are assigned to a cohort. They work in cohorts. So if someone tests positive, then we know that we don't have to shut the school, that we need to first address the cohort.
Mm.
And that is important. Our entire endeavor in the Roosevelt Union Free School District is that we emphasize safety, teaching and learning. There are 3 buckets that I just want to put out there: teaching and learning, operations and safety, as well as support. And with all of those factors coming together, that determines our approach and how we respond to anyone who tests positive, if it's a student or staff member.
Awesome. Awesome. Dr. Rowe, right? Given all of what Dr. Mappin has shared, Dr. Worthing, Principal Jacko has said, we know all of this can cause a lot of stress and anxiety amongst our family and our children, right? What are some comfort strategies for families and children as they are considering, and gearing up for, re-entry into schools? How can we assure, right? Because, we're not having the conversation that we're having all the time, right? Because it's so hard to have these dialogues and try to implement the strategies simultaneously, right? So what can we do to assure and comfort our families that, our school leaders, our admins, our superintendents are doing all that is necessary to ensure the safety of our children? So talk to us, Dr. Rowe, about how to, comfort, some comfort strategies, because I need them too. So help me.
Yes. Well, I really believe that children and parents become nervous and they become worried when they feel like they don't know where they can go when they need help.
Mm.
So I think that one of the things that comforts parents and children is to know where they can go and who can help them. So that could be reaching out to your school support team, if it's the guidance counselor, if it's the social worker, if it's the psychologist who is on staff. Children need to know who can help them.
Mm-hmm.
There is nothing like feeling like you are in a crisis and no one is there to help.
Mm-hmm.
So I really encourage parents to reach out to your schools. If you know that your child really had a difficult time um, transitioning, you want to be the first person to reach out. You don't want to wait until your child is in crisis to then say, you know what? Oh, yeah, I did forget that, my daughter cried every time, like that I left or something like that. So that's one thing. I would also say parents to just be mindful of your own anxiety about your child going back, because
Mm-hmm.
that rubs off on them. Like they can sense when you're not okay.
Yeah.
And if you're putting it out there that it's not safe and, my child is in danger, like your child is really going to sit there like, well, maybe I am in danger.
Mm-hmm.
Maybe I should be afraid of something. So, I think that parents should be mindful of that. Um, and I'm always a fan of positive affirmations. So every morning before they leave home, you want them to say that I am going to be safe. I know who I can seek help from. As people of faith, if it's not an affirmation, you can say that this is the scripture that you're going to say whenever you're nervous, when you are in class. And I think that those things are very comforting. It's something that everybody doesn't have to know that, they're doing it. So it doesn't feel like everybody is watching me while I cope. So it's something that's personal that they can do. So I think that those are comforting um, things, in addition to, if they're over 12, being vaccinated. Like, that's a layer of
Yeah.
protection.
Yeah.
And I think that if parents feel like they have that, then it kind of lessens the anxiety. And then for those who are younger, going over washing your hands, you're not going to share anything with anyone. You're going to stay 6 feet apart, 3 feet, 3 feet in, some of your classrooms. So just making them aware of what they can do to remain safe
Mhm.
really helps kids to feel comfort wherever they are.
Awesome. Thank you, Dr. Rowe. I have a follow-up question for you, Dr. Rowe. Right? How, in addition, right,
Right.
how should parents be communicating and instructing children about COVID-19? Right? How can we minimize fear while accommodating the social needs? Right? So,
Mhm.
sometimes parents can be, their own fear, as you just alluded to, can be projected onto their children. How can they, communicate and instruct children about COVID, and to accommodate their social needs and
Mhm.
relieve, and minimize fear around COVID-19.
What's so interesting is that I was in school. I was actually in the school building last year, and the students were not worried about COVID. They were more worried about what the day was going to look like.
Mm-hmm.
They're, it really depends on what the environment is,
Mm-hmm.
letting your kids know that things may look different.
Mm-hmm.
You're probably not going to be in the gym.
Yeah.
Lunch may look different.
Mm-hmm.
So kids were more concerned about getting back to the school,
Yeah.
and some of them were just very thrown off that the things that they used to be able to do, they weren't able to necessarily do now, or, that it was done um, differently. So, I definitely think reminding them of all of the safety features that they need to have, um, letting them know, what, mommy or daddy, we're kind of nervous too. We're not really sure what this looks like.
Mm-hmm.
We're gonna work together so that we can make this a good year. If you ever have any issues, if you ever have any problems, please, like, let us know so that we can help you. So I really think that those are ways that we can um, assist students as they're coming back and as they're just trying to figure out what's going on. And again, just identifying the
Yeah.
people that they can go to for help.
Awesome. Thank you so much, Dr. Rowe. So a lot of parents, right, are really, I know since, I went back a few days ago, but while I was on break, I had a number of parents calling, when is school starting, right? You have those parents that's just like, they have they have to go, right? When is school starting, right? And I'm like, I know you got the email, I know you got the text message, the robocall, you got all the information. It's not today, right? They're not, the school is not starting today, right? I still got a few more days till my break. But there are a number of parents who's just like, their kids' bag is at the door, right? Clothes are laid out, right? Dr. Matherin talk about some safety protocols and steps that parents should be implementing with their children while they're traveling via public transportation, school buses, And then talk about a little bit, about the things children and families should be doing entering and leaving home, right? So first talk about, the steps parents can do to implement their children's safety while traveling, and
Mhm,
just some safety protocols for leaving and entering the home.
mhm,
Because for
mhm,
some parents, they like, you are getting out of here
mhm. Yes.
Wednesday.
Yeah. For well, as much as you can, because I know New York is an area that is pretty populated, so there's only so much you're going to be able to do in terms of that social distancing when you're traveling. But you do have to try to maintain that as much as possible. So making sure that children who are definitely old enough to understand, and even the littles. I mean, our little guys and girls, I really have to give them a lot of credit, because where we thought they wouldn't be able to do something, they've
Yeah,
done it. They've kept those masks on.
yeah.
They understand. So making sure that they understand when we're traveling that we need to do that as much as possible. Keep your mask on. Also, what's interesting when is it Dr. Rowe was talking about what's happening with families, and making sure that you don't put too much anxiety on kids. What's been really interesting and sad to watch happening among children this past year, in just a year, is how much obesity has become of concern. It was concerning prior to the pandemic, but during the pandemic, all of us pediatricians, any providers providing care to children, we've been watching this, and we've been seeing, kids really increasing in weight. So when I
Mhm.
hear, when you say travel, it seems weird. Where's my thought going with this? But I'm so excited for kids to be able to get back out and do that travel. So, in addition to social distancing and making sure they mask, making sure they're moving their bodies during that travel as much as possible. I remember, New York, the New York City subway system. I know there are elevators where you can take stairs when you get to where you're going. Use it as an opportunity to move your body. Um, I think, and I don't have the exact quote, but I know it's another study from the American Academy of Pediatrics that said that there's been a 26% rise in the amount of obesity among children when compared to the year prior. And it really wasn't surprising to any of us. And getting back to like coming home, you know, um, I still do the same things, and I recommend it, that I did at the beginning of this pandemic. I'm still doing them now. Even though we know more about coronavirus and how it's transmitted, I don't think that there's any way that you're going to go wrong with making sure when you come in that door, you hand wash. You're mindful about how you're taking your mask on. Off. Don't just put your hands here. Use those ear connections and unloop it from your ear. Place it down carefully. Go immediately wash your hands. Take off your clothes. Come back and wash your hands again. Those are just really good habits to get into, so that you're doing. Leave shoes at the door. So you're doing everything you can to not bring that virus, because it is a reality. It's still here. You don't want to bring it deep into your home. Do what you can to, just get it off before you activate yourself in more places in your home.
Thank you for that, Dr. Mathman.
Mhm.
So, as we are considering what we just transitioned out of, right? The whole notion around hybrid education. Is it something that we need to consider, right? And add to what it is that we're doing or implement as an alternative for maybe children who may be exposed, right? Or have some pre-existing conditions. Principal Jacko, Dr. Worthing, either of you can answer this. But from a superintendent perspective, I would like for, and a principal, I'd like for both of you to chime in on this. What are the quarantine protocols for children who are exposed to COVID, right? Is there a hybrid accommodation, right? Because I know for some, schools that is no longer an option. It's in-person instruction. Is there a hybrid alternative for those who have been exposed, or they just quarantine and return when they're able to, right? For the children, even who may have self um, health concerns about contracting COVID, right? So, is there a hybrid option In your district, Dr. Wortham and Principal Jacko, in your school, do you have a hybrid alternative for those who contract the virus?
You know what? I'm going to answer, and I really wanted to answer or add on to Dr. Matherin's
By
uh,
all means.
statement as well. We have to do things that our young people are used to being active. And I want to say, Dr. Matherin, I don't know that I've noticed necessarily an increase in weight gain for the young people, but surely my data says that
Surely.
surely, surely my data says the scale has gone in the wrong direction. So, but when I think about those strategies of being safe,
Mm-hmm.
we want to make sure, and you have to put it to music. Do something that will engage our young people. I think about how we tell the students mask up, measure up, check up,
Mm,
mask up, wear that mask, measure up. When you come in the door, take that temperature and check up. Do your daily screenings. Do your daily screenings at home. One of the greatest things that I saw on the first day of school in our middle school was that our young people were outside prior to going into the building, and they were doing just that. They took out their cell phones. They had the QR code. They scanned the daily health screening. And to see how their faces lit up when they gained entry into the building, it's a process. And if we put it out there just like that, if we turn it into a language and allow our young people to articulate what the next steps are, then we can continue to move forward. Our children must we must abide by educating the whole child. That's not just a buzzword, but we just have to make sure that we live by those five tenets. I see you, Principal Jacko. I'm gonna throw it to you in a second, and I love that affirmation. Yeah, yeah, yeah. So those five tenets, you have to make sure that the students and staff are healthy, safe, supported, engaged, and challenged. When your young people can articulate that,
mhm.
it is part of the norm.
Yeah.
We want to take advantage of a crisis.
Yeah.
There are skill sets that we learned during COVID-19 that we never would have thought about teaching in the classroom.
Mm-hmm.
Not at all.
Mm-hmm.
So we want to, those skills that we learned, hybrid learning, teachers teaching, symptomatic, synchronous, asynchronous teaching and learning. Those skills we want to continue to embrace and not say, well, that was for COVID, not now. Because
Mm.
I dare to say that our young people subscribe to a learning loss. I subscribe to a learning increase because
Mm.
there are things that our young people learned during this time that were unintended outcomes. I'm
Mm-hmm.
going to throw it to you, Principal Jacko.
Good stuff.
I'm sitting here like, yes, yes, yes. And I say, and to that, there are some things that we're definitely adding to our cadre of tools.
Mm-hmm.
And so if students are contracted with or exposed to the virus, there are certain measures, whether it's Google Classroom, students will be able to access material remotely. And that's the asynchronous work and synchronous work for teachers. And so my best advice would be to make sure that your emergency contact information is
Yeah.
up to par. So make sure they have your accurate email, telephone number, and emergency contact. I can't say it enough. Even if it's a robocall or an email, if a school needs to contact you, you want to make sure that that stuff is up to date. Now, for my school, we do have a school app where you can do some of that stuff electronically. And so be a partner to your school. There is no to a parent who is willing to bring their treasure to a
Mm-hmm.
school. And treasure could be your money and your talent.
Mm-hmm.
So know that you have a space at your child's school. They need you. They are looking forward to partnering with you So with any of these questions, I say we thrive at 35, but in addition to that, we practice the miracle morning. And so we have silence, a positive affirmation, visualization, exercise, reading, and scribing. And so we are adding that into our curriculum because you have to know everything is right about you. And when you come in, no matter what you're bringing, whatever happened, whatever it is, making sure that our students know that it's a safe place. They are dealing with a lot. And especially with coming up to 20 years of 9/11, we can
Mhm.
think about it, especially in New York City. I remember being in a school when
Mhm.
that happened, and you can see the smoke in the sky. And that was the first day of school for us. And I remember not knowing when parents were going to come to our schools. So do know your school leaders are equipped to deal with the crisis. But this, we're not calling it a crisis. We're calling it a learning curve because
Yeah.
it's absolutely an exciting time. We can't wait. We're a homecoming to our students, specifically going back to exercise. You can partner with the Department of Transportation. We are closing streets in front of our school so we can add to the places where students can go outside and get some fresh air during those times when we can. So movement is definitely part of our curriculum and giving our students walk breaks. And for us too, I'm in the process of getting some weights for the teachers in the room because we gotta move. We have to
Listen.
move to improve. So I'm excited. I can't wait to see the little faces come in. So I like that. I wrote that down. Mask up, measure up, and check up. I got it.
You may have it. You may have it.
Thank you,
That's
Principal
next.
Jackson. Thank you, Dr. Worthing. Dr. Rowe, how can families best prepare to navigate the potential changes, right? And Principal Jacko just gave us some language for the learning curve, right? We're not even going to call it a crisis. We already know it's a pandemic, but it's a learning curve. How can families prepare to navigate the potential changes of
Mhm.
this learning curve? Because we're changing every day. And then we're going to go to some questions in the chat. We'll let you give your final thoughts and we'll conclude for the evening. Dr. Rowe.
Okay, I really believe that what throws us off kilter is when we don't know what is going to happen and when we're not prepared. That's when everybody gets hysterical, like, oh my God, I'm supposed to leave. I'm supposed to. So, like Principal Jacko said, is really make sure that everything is up to date. You want to find out, like, how will your school communicate with you? Will it be a call? Will it be an email? Will it be a memo? I think that what happens is when a school has to quarantine or when your child's class has to be home, those decisions are made and the change has to happen immediately. So you have less than 24 hours to get yourself together. And one of the best things that you can do, again, is to just make sure that you have everything in one place
Mm-hmm.
so that you know what has to happen. Like you follow the protocol that your house needs. So I've actually created a resource guide that actually has that. It's about 5 pages, and it has questions like my child's school is, the address is, the phone number is, my child's teacher's name is, how would she or he like to be communicated with, um, if my child has to come home, who will they stay with? I think that that's one of the biggest questions that comes up when children have to be at home very, very fast. And then if your child has special education support, when is his or her IEP due? When is the reevaluation? You know, if they get counseling, if they get speech, if they get OT or PT, when will those services occur? You want to make sure that you know that before the change comes,
Mm-hmm.
because once the change comes, you're trying to figure it all out at once, but you want to do it when you're calm, when you're not under pressure to make it happen right away. So that's definitely something that I think that will help parents to navigate. And it's an inconvenience, yeah, it is.
Mhm.
But it's a little bit better when you know, okay, I know that I can call cousin Barbara to watch Tony tomorrow, you know? So yeah. So if you are interested in that, you can visit my website, join my email list, and I will have it up this weekend.
Dr. Rose said, sign up for the newsletter.
Yes, because it's something that I saw last year. It happened so much, and there were so many parents that were thrown off. And Principal Jacko said it. These numbers, y'all, please update your numbers, pay your bill so that the phone is on. I know it's, but do it so that you can know like what's going on. You don't want to be left out there. I've been in schools where the school has been quarantined and the kid still shows up with nobody there. Like
Mhm.
you don't want to be in that situation, just because something was left off. So, yeah.
Thank you, Dr. O. Dr. Matherin, in the event a child contracts COVID-19, what are the best practices and protocols and steps a family should take to remain safe and to care for the affected child in their home?
Hmm. Yeah. So if you have a child that is known to be positive, certainly everyone in the household needs to be tested. There's no guarantee that others will be, positive as well. This
Mhm.
virus is very unusual in that way. You may have someone, one or two persons who are positive, but what, particularly for kids who are very young, they can't take care of themselves. So that positive child, even if the parent isn't positive themselves, they will need to quarantine with their child in order to, um, provide them care during their own quarantine. So, doing that, the persons in the household who are not affected, as much as we can, isolate from those persons who are affected. That's not easy to do in every household, but doing it as much as possible. And again, in those settings, hand washing, all of that becomes, even more important, but it should be the routine anyway. So it shouldn't be anything that's new. Now, being responsible as well. If you know that you are positive or there's someone in your household who's positive, be honest in not inviting persons to your home. It's not the time. It's not the time to go out and join group settings. We'll have sometimes outbreaks that occur because of, you can't say it any other way, but irresponsible behavior.
Mhm.
This pandemic requires all of us to care for each of us. So if we're not going to do that, I don't have positive things to say about where we're going to go. But because I believe that gradually, I think we're getting it. I think we do want to come out of this. I think we all will take responsibility for ourselves if we find ourselves in a positive COVID situation.
Thank you. Thank
Mhm.
you, Dr. Matherin. So I have, there's a slew of questions in the comment section. I'm going to probably pull about a few out of there. And then if you ladies can, at your leisure, go back and maybe you can answer from your seat of expertise some questions. There's some amazing questions in here, but one of them that really stuck out to me the most was concerning school nurses, right? Will school nurses be, in the buildings throughout? Do your school have a school nurse, Dr. Jacko? Does your schools have school nurses, Dr. Wortham?
Yes, and I did see in the chat that there is a school nurses chat for on Facebook, and yes, there are school nurses in the building, and they will be supporting some of those isolation that needs to happen. And so the protocol is to go to the school nurse, and that's why we need to contact someone. So having an updated emergency contact is crucial. So yes, there are protocols in place with school nurses in schools.
Thank you. Thank you for the
Yes, we definitely have nurses in our buildings.
Mhm.
Each school has their own nurse. And in addition to that, we just opened a clinic in the high school.
Nice.
So, and we have a registered nurse as well as a social worker there. What is amazing, last week we actually had a vaccination van and we were able to offer the vaccine to our community. We had
Wow.
40 students to receive the vaccine on last week. So, can I just pivot back over to Dr. Mather? And she has such great responses, everybody does, but I just want to continue to add to the fact that when there is an outbreak, we have positioned our students and staff so that we have a one-to-one device.
Mhm.
Every student, every staff member, that includes central office, they all have Chromebooks. They all have the capacity now to work from home.
Mhm.
So it won't be a knee jerk reaction. What do we do? What do we do? We are prepared. We are prepared to pivot and to continue to
Yeah.
work from home decently and in order.
Awesome. Dr. Wortham, have class sizes become smaller? I don't know what's happening with you. We might be getting a doctorate soon because I keep calling.
Yes, and so it's so interesting. We have students coming in on the 13th. Our teachers have been working for the past 2 weeks. I've actually gone into each classroom with a measuring stick to make sure that
Nice.
it's a 3 foot. We're going to be master measurement
Yeah.
experts. This is going to be the season of 3 feet, 6 feet. We're going to have that down.
Yeah.
So I would say in each classroom, we made sure that there's no clutter in the classroom and making sure
Mm,
that things, because will get sprayed every night. There is pinpoint cleaning that happens 3 to 4 times daily in all common spaces. And so I am in each classroom measuring desks and measuring spaces, and specifically the egress out of a school. I'm making sure that students do not interact with each other. So they come in one way and out one way. So you also want to be mindful of those in the entrance and the egress where people come out, which follows our safety protocols, just like fire drills. So it's the same procedure.
Awesome. Speak about someone lifted up, and this is our last question. And I'll have you all give your final remarks under 20 seconds, right? Someone spoke to lunchtime, right, where students are removing their mask, right? How do we prevent, the spread in that space and in that time during eating?
So I love this question because as a school leader, your number one point is your work with your families. But my number two is school foods and custodial team. They're on my speed dial. And so we have marked, especially in my building, different spaces where students will be able to eat. And they are separated. Like in most tables, you can only have 3 to 4 students at a table. And so certain areas are separated, whether it's the cafeteria, or some students might actually eat in their classroom to maintain that same distance. But it is 3 feet and they have to be separated. So if you go to the restaurant and you're separated, it's the same protocol as well.
Awesome.
so that's great because we use the analogy that if you're in Manhattan, if you're in the city, you see the creative ways restaurants have extended their capacity. They have taken over the bus route, and they sectioned it off. Well, we have done the same way. And the spirit of creativity is permitted.
Yeah.
So we now have outside areas, courtyards, where and our kids look rich, outside single mingling, just eating, and we have taken the safeguards or the hindrance of what I can't and shift that into what I can. And I can experience a fine dining opportunity, if you will, on the courtyard or on the parking lot and put up barriers outside. Let's bring some flowers. Let's, make it look really appetizing and allow our students to breathe and to enjoy each other's company within the confines. And the 3 feet you said of the class is reduced. No, we have received, our enrollment has actually increased. And exactly, because we brought our community to the table, we brought our teachers to the table, and this was the largest task force known to man because we needed to hear and listen instead of reacting. So we entertained and brought the ideas to the table, and so we are moving forward decently and in order. I'm excited about the safety for our young people and for our staff.
Mhm.
Wow. Family, this has been an amazing, rich, informative dialogue. And I pray that you got the information that you needed, and that you received what was said. Right now, I'm going to give each of the panelists 20 seconds to give us some final thoughts and where and how people could get in contact with you. So provide some kind of professional linkage, contact information where people can get in contact with you to further, inquire about whatever it is that may be pending. But thank you again, Dr. Matherin, Dr. Wortham, Principal Jacko, Dr. Rose. Thank you for helping us create this holistic dialogue where we're tending to the minds, the health, the brilliance and the physicality of our young people. Thank you on behalf of our youth pastor, Ignite Youth Church, Minister Reverend Edward Jordan. We say thank you on behalf of our pastors, Reverend Dr. Floyd and Elaine Flake. We say thank you. Dr. Rowe, I'm starting with you.
Okay, I am Dr. O. You can find me on Instagram at Pivotal Point Psych, and my website is also www.pivotalpointpsych.com. And you can also find me on Facebook. I would like to say to just be ready for anything. And when you need a moment, take a deep breath, take a minute, and then go and do what you have to do. Also, just pay attention to changes in your child's behavior. If you notice that they need some extra help, reach out to people who are in the school, and then also ask for outside recommendation for therapists if that's something that you would be interested in for your child.
Awesome. Dr. Wortham.
Well, we have expanded our vocabulary in the last 18 months. Quarantine, pivot, isolation, but we've also learned, although we had to quarantine, although we had to isolate, we learned the merit and worth of really being together.
Yeah.
We've learned the merit and worth of actually learning to communicate, to use the tools that we have available, and you don't and you shouldn't walk alone. Stay together. We learned that in kindergarten. Stay together. Rest, eat well, wash up, and don't forget, pray.
Thank you, Dr. Wortham. How can we
You
see?
may find me at D Wortham,
Yeah.
D Wortham at rufsd.org.
Thank you. Dr. Matherin, thank you. Thank you for your expertise tonight. Thank you for your keen insight. Keen, she didn't say nothing or use no words I didn't know.
Well, my pleasure. But thank you. So, I can be found on Twitter at Doc Matherin, DOC Matherin, my last name, Mathurin. And 20 seconds, I'm definitely going to use it to say, get the vaccine. If you are of age for this vaccine, 12 and older, it is safe, it is effective. You should get this vaccine. And we're waiting for the little ones to be able to have it, hopefully by the end of the year. If not, by the beginning of 2022. Safe, effective. And if you have any questions, you should be talking to your pediatric provider, your adult provider about the vaccine. Okay. We want our patients to be safe and healthy. So it warrants that time with you to Ben, any questions that you have, we want to answer them so that you will protect yourself and get vaccinated.
Awesome. Principal Jacko.
Good evening. Thank you so much. Protocol established already. Thank you so much for this opportunity to share with my Greater Allen family. You can find me on Instagram at Principal Jacko. What I can say is that everything's right about right now. Every experience that we did, we got our each other's attention. Now it's time to have a breakthrough year. This is a year of a breakthrough. We did talk about literacy. We know that literacy is a gateway to poverty, mental health, and overall well-being. So get snuggled into a book. Be mindful of where we are. This is a year for a breakthrough. And I'm so excited to be here. This is a homecoming. I'm ready to go. And so I'm just excited. I can't wait to meet the panelists and get that 5-pager pamphlet. Thank you. And so I'm excited. And to any parent on here, you are a partner to us. You are your child's first teacher. We cannot do this without you. And to every school aide, every school safety officer, every custodian, everybody, every title, we want to say thank you. So if you didn't hear it today or tomorrow, I want to say thank you. We need you. And I am so excited to be here.
Thank
Have
you.
a good night. Thank you so much.
Thank you, ladies, again. Thank you again to our Greater Allen family for tuning in with us. We are hopeful and just anticipating an amazing, seamless school year. So we hope that what we've offered here tonight has soothed your anxiety, had helped to settle your nerves, and to get you excited about this school year and what's to come from these amazing leaders who have been offering us insight and who has been on the front line helping us to navigate. And what I appreciate that they're offering us insight from the perspective and I know they serve diverse communities, but as people of color, we are excited that they are here sharing their expertise and giving us keen, accurate, as Dr. Word would say, facts on how to navigate this process. So thank you again, ladies. Thank you, Reverend Jordan. Thank you, Reverend Doctors Floyd and Elaine Flake. And thank you, Allen family. Have an amazing night. God bless you.
Bye.